Hi, everyone. We're presenting on assessing the past and predicting the future of COVID-19. And so just a little about us. I'm Taylor, and this is Emma.
So our purpose for the whole this project was, in case you've been underneath a rock for the last 2 years, we're currently going through the COVID-19 pandemic. And so since it's been such a large part of our lives the last 2 years, we thought it'd be useful to analyze this data to detect significant factors that affect the number of COVID-19 deaths, discover any effect of vaccinations on COVID-19 deaths and positive rates, and protect future hotspots of COVID-19 based on our current data.
So to get into our data collection, we collected data from a couple different sources. So our CSV file was from Our World in Data, which is a file that compiles COVID statistics and is updated weekly. Our HTML is from a Wikipedia article where we took data from two tables that details the cumulative number of deaths for each country at the start of each month this year. And our JSON files are from the CDC and contain the weekly Pfizer, Moderna, and J&J vaccine distributions for each state and territory.
So for cleaning our data for our CSV file, first we removed any extra columns, and then we renamed them to increase readability. And then we grouped all our data by country, and then we removed all the countries if they had name values for the data we wanted to look at. And then we sorted our data frame by the number of people fully vaccinated in ascending order.
So for our HTML file, we pulled the data from two different tables and ordered them to make sure that they were correct when they were concatenated, and we found the number of deaths for each month instead of just the cumulative number of deaths because it allows us to make better insights.
And so lastly, for our JSON files, we used slicing to only extract data that was readable and useful for us. We fixed the date format to create uniformity across the data sets, and we determined if the file had data for the 2 dosages, Pfizer Moderna, or 1 dosage, which would be the Johnson & Johnson vaccine. And then we created new pandas data frames for each vaccine type.
So to get into our data analysis, we took a general to specific approach where we started our analysis at the international level to make some high-level conclusions, then moved down to the national level to make some conclusions about the United States as a whole, and then we moved into the state level where we actually took data from each state to make a very specific conclusion.
So here's some of the questions we're going to be answering in the insights, which is going to now follow with our analysis.
So for our first insight, our goal was to determine if the HDI, GDP per capita, and population density are correlated with any of the COVID statistics. So first, we discovered that the HDI was relatively highly correlated with all the statistics, and we found that our highest correlation was a positive one between HDI and vaccination level, which makes a lot of sense since a high HDI would warrant the country being able to afford vaccinations and support citizens with established healthcare infrastructure. Second, we discovered that GDP per capita was less correlated than the statistics that we had against, but still had some relatively strong ones. So we found our highest correlation with the GDP per capita was also with the vaccination level, which makes sense because a country must be able to finance vaccine distribution and have enough infrastructure so that citizens could get a vaccine. Lastly, we discovered that population density actually really had no correlation with any of the COVID statistics. This is likely because population density differs greatly whether a country is developed or undeveloped. And the reason this insight is so important is because it allows us to make predictions about a country's statistics based on their HDI or their GDP per capita, which is vital to understanding where support and vaccinations can be provided. And on this slide, we actually show our visualizations separated by their level of correlation to support and confirm the findings from the previous slide on the correlations between developmental variables and COVID statistics. So for our second insight, we wanted to determine if any of the COVID statistics would have a large effect on the total number of COVID cases per million and the number of people who are fully vaccinated. So to test the effect of the statistics they had on each other, we decided to create multiple linear regression models that test how independent variables affect a dependent variable. So as you can see in model 1 and 2, the dependent variable in this case is the total cases per million, whereas model 3 and 4 have fully vaccinated per 100 as the dependent variable. And the difference between each of these models is that the independent variables are different, so we can see if there's any differences between these models. And so the first thing we noticed from the results is that only the second model for each dependent variable was effective based on their adjusted R-square value that's highlighted in the top corner, which is very different than expected, and it could be attributed to either lower multicollinearity rates or something else. And so to go into a bit more detail about what statistics were significant compared to each dependent variable, we see that the first model actually shows many significant independent variables, while the second, third, and fourth all show only 2. And so an overall conclusion that we can make from this analysis is that we can see that GDP per capita actually has the strongest effect on the total number of cases per million and the number of vaccinated people, which does make sense, and it's stronger than the other significant variables. And this insight is very useful because these regression models allow us to predict total number of cases and the number of vaccinated people in different countries based on estimations from independent variables, and this can also help us focus our support in vaccinations in the future. So our goal for the third insight was actually to find the top 5 countries with the highest number of deaths due to COVID, then find the minimum, maximum, standard deviation, and variance to see if there's any trends or comparisons we could make between the data. So as you can see, the standard deviations seem to be pretty high, but remembering that we're dealing with numbers in the hundreds of thousands and many new number of deaths per month differ greatly from each other, so this is something that we could expect. An interesting point is that India actually has the smallest minimum and the largest maximum out of all the countries, so it actually further explains why the standard deviation and variance are so high. And so as you can see on the right in visualization 2, the number of new deaths per month for each country, we can actually compare their trend data from the graph. And so you can see that the United States started off the year with the most number of deaths, which makes sense since it was going through a second spike of COVID-19. And another way we could use this graph is to potentially predict where the lines would continue on their current trend, or if factors like the Omicron variant and more people getting vaccinated would change their trajectory.
So we also created this map using our data from the whole world that shows the number of cumulative deaths in 2021 each country has, as color based on the scale shown in the legend. This is another way to show the number of deaths for COVID each country has, and then you can potentially figure out why that is the case and what the difference is in some of the countries. So for our fourth insight, our goal for this insight was to find the total number and percentage of each type of vaccine distributed across the United States to better understand the magnitude of distributions per company. So we hypothesized that the Pfizer vaccine would have the highest distribution throughout the U.S., and that Pfizer and Moderna would both be significantly higher than Johnson & Johnson. So through June 21st, 2021, we found that 51.23% of the vaccines distributed were Pfizer, 42.85% were Moderna, and 5.92% were Johnson & Johnson, which confirms our initial hypotheses, and you can also see this in our pie chart. This makes sense because both the Pfizer and Moderna vaccines were approved earlier than the Johnson & Johnson vaccine, meaning that they had more time to be distributed across the country before the Johnson & Johnson vaccine was approved. Pfizer and Moderna also have a higher effective rate than Johnson & Johnson, which has also probably influenced people's decision-making as to which vaccine to get. The difference between the distribution of the Pfizer and Moderna vaccines can be attributed to Pfizer getting more positive press, being marginally more effective, having a faster production output, and being the first vaccine to be approved for use in children's 12 to 16. Ages 12 to 16. So for the future, we expect Johnson & Johnson will have a higher percentage distribution throughout the U.S., but Pfizer will still likely be the majority due to its getting FDA approval first and being approved in children's ages 5 through 12. And then so for our final insight, here we wanted to make a more specific conclusion and find the average number of each vaccine, average total number of vaccines distributed per week for each state and territory in the U.S. This is important so we can see how each vaccine each state got, so we can see if each state had appropriate supply for the population. So we predicted that the higher populated states would have more vaccines distributed to them on average, and states and territories with smaller populations would receive less. So from our data analysis, we found that the 5 areas that would receive the most vaccines are on average that you can see on the slide, with California being the largest, and the 5 areas that receive the least amount of vaccines on average, with Peru being the smallest. This supports our hypothesis and makes sense because states with higher populations need more vaccines to supply their population, while areas with lower populations need less. What we found interesting was that New York was not in the top 5 highest of the vaccines distributed, despite being the 4th most populated state in the U.S. And we were also not expecting the federal entities to be in the top 5, but it does make sense because this probably includes people who work in embassies or in the military. So for our conclusion, some key learnings we have was there is some sort of correlation between economic and development factors and COVID-19 statistics, and how each vaccine is distributed across the country and across each state, and also how the number of deaths per month differ for each country and what that means for the future. So some challenges we have are just some learning some new modules, and we are problem sorting and concatenating data. And so some potential next steps you can take is just further research and analysis to answer any new or unexplained questions from our analysis. Thank you.